Hi, everyone. I hope everyone can hear us. Let me just make sure. Can you hear me, Dr. Jing? No?
Hello?
You can hear me?
Yeah, I can hear you.
Okay. So it's about
Yes.
4:17, so we're going to get started. I'm just going to give a little introduction. So today, me and Dr. Jing are going to talk about pregnancy care and, how to take care of yourself during pregnancy, how to optimize your health. Dr. Jing is going to talk about the different stages of pregnancy and, how to keep your chi energy flowing during the pregnancy. And then I'm going to talk more about the diet part. So I think everyone's muted, so that's good. And then at the very end, we're going to do a little Q&A session. So if anyone has questions to ask at the end, we'll save it for the end of the meeting. And so we're going to do a Q&A at the end. And then if anyone misses if there's some of the information that we went by too quickly, we're going to post the recording on YouTube, on our YouTube channel. So if you missed any information, don't worry, you'll be able to watch it again later on. And if some of the information, if you do need to take a screenshot of some of the information, you can feel free to do that as well. Okay, so we're going to start with Dr. Jing. And so I'm just going to put up the PowerPoint first. Okay, do you see it, Dr. Jing?
Yeah, I see it. Okay, let's start it. First of all, welcome everyone to join us to learn or discussing to pregnancy care in TCN. So, and most people pregnant. So we first of all, congratulations. So when you're pregnant, it's not a job done. So most important, so we need to keep the baby and to have a healthy pregnancy to make the mother comfortable. So, and in Chinese medicine, we have long history and profound experience in pregnancy care. So, which means we normally involve the yang tai or hu tai, which means the nourish the fetus and protect the fetus. Nourishing the fetus, usually we begin just try to treat early on condition, just like in the first trimester. So we really care what's happening. So miscarriage. So, and usually happen if it's the 6 weeks miscarriage happen, usually we need 3 bumps. And the first bump is 6.5 weeks. So very easy to last heartbeat. And the second bump is 8.5 weeks. You're very easy to last the heartbeat. So, and then next is 10, 11 weeks. So usually those bumps, so we really needed to, if it's a healthy pregnancy, we need to try pursuing to promote the circulation flow, so can help miscarriage happen. So which means what we do in Chinese medicine, we believe in this moment, all the qi and the blood as a woman to nourishing the fetus. Your fetus is just like a foreigner. So start to into your channels, into your body, into your soul. So therefore, in 4th trimester, you have to be quiet. You really quiet the environment. You cannot into the parties, the busy stuff. You can overwork. You need to really rest. So, and again, so as we can pass those steps, usually in the 6 weeks and the 5 weeks pregnancy loss, often is, of course, is a chromosomal issue, and often is like a immunological issue. But 8.5 weeks, the pregnancy loss usually is the chromosomal issue, so could be happen a man and a woman. But when it's 11 weeks, pregnancy loss, sometimes the majority of times statistics say it's a sperm issue. So just like we deal with the Western Eastern together to help men and women together. So when you're pregnant, we really help a woman chi and the blood circulation flow and grounded. We can just help have healthy baby, healthy pregnancy. And also, and we can help the morning sickness. So morning sickness is just like why have morning sickness? In Chinese medicine, we believe and your chi and the blood flows simple, balanced environment. When you're pregnant, almost like a foreigner into your uterus. Uterus channels involved with the stomach channel. In Chinese medicine, stomach channel is the qi is downward. And when you have a foreigner things, your qi is starting to go upward. That causes you have morning sickness, or sometimes become to evening sickness. And however, when we open the qi, especially stomach qi and also like a large intestine qi and the heart qi channels, so we can just start to opening to helping you morning sickness. It can helping first trimester fatigue and help first trimester like a depression. Some people are suddenly depressed because you qi in the blood to nourishing your fetus, and that you don't have to nourishing your brain. So, and then your serotonin level just drop down quickly. So you have depression. And the second one, protect the fetus. So mainly we're just talking about any kind of condition we can help. So first of all, it's IUGR, so intrauterine growth and restriction. So we have several people have this issue. So people like pregnancy 6 months and they check out with OB, so only 5 months or 4 months. So by going to weekly Chinese medicine acupuncture and take specific herbs, the baby become to full term and even more healthier, more calm, and the woman's very healthy and the woman's very happy. And also along way, so we can help with gestation diabetes. Gestation diabetes and it really happens as a PCOS patient. In PCOS patient, so even your blood sugar is normal, everything's normal. So due to the hormone, so very easy happen this by 26 weeks, 28 weeks, you cannot pass the test. So develop your gestation diabetes and the baby's over big is not healthy. So therefore we have from first trimester to how to take care of your exercise and also diet-wise, and Dr. Lim is going to deeply to talking about, so to protect them and do not have gestation diabetes. And also sometimes we can treat the constipation. Lots of patients, so from the pregnancy, because of hormone issue, very easy cause you constipation. Constipation, as you know, they're holding more toxic. So we really from the diet, exercise can help. And also like pregnancy anemia and also placenta previa. We have several patients, lots of patients have this condition, placenta previa. So, and from partially previa or complete pregnancy previa, we all successfully helped as long as you continue with us and take the tea. And also bridge baby, so we help everybody help very successfully. So one thing is just like lots of patients on the pregnancy time, so they fear take herbs and they fear say, oh, they can do acupuncture, they don't want to take herbs. Actually, in Chinese medicine, the gynecology part, so even acupuncture, lots of part we cannot use. For example, first month pregnant, we're not supposed to needle your liver channel. In the second month pregnant, we cannot use your needle your gallbladder channel. And followed by for heart channel, third month, and the fourth month is sanjiao channel, fifth month is spleen channel, and the sixth month is stomach channel, and the seventh is the lung channel, and also large intestine channel, and the ending up is the kidney channel and the bladder channel. So which means we do have contraindication. And so as herbs, we have tons of contraindication, not supposed to be used in pregnancy lady. But if you're coming to professional people, we know what we're doing. In fact, we can helping on the first line to help you by naturally to help your body engage, to help yourself. So instead of Western medicine, so Western medicine can help, but for doing a pregnancy, it is limited. I really wanted to bring that up. So, and you come into our office, we are professional trained, so you do not need to worry and what herbs we cannot use, you're afraid about things. Next slides. Buckland, can you move?
Do you see it?
Next slide.
Yeah.
Okay. Yeah. So, and when you're pregnant, like I said, it is we are our human beings, a part of nature, and we must be follow the nature and follow the yin and yang, and follow the 5 elements, and harmonize our body. We can have a healthy baby, healthy pregnancy. And the next slide. Next one. Next one.
You see it?
Next one. Okay. Yeah. So, and during the pregnancy, so I just wanted to give you a little bit of idea, just like when we're really pregnant, so we can, first of all, and the woman, especially as long as you're pregnant, you need to try to practice daily to have a pure heart, have a good attitude and gratitude, positive thoughts, and speaking kind words, and then watching the nice things. So in this way, and keep your environment quiet, especially in first 3 months period of time. This way we call 安静静, quiet. Quiet means your soul quiet and your mind quiet and you pure for. This way, and they did research, clinical research, begin with that. So the baby, I'll be cultivating their good temperament and a good, wise, and smart baby begin with. So kind person. So that's number 1. Number 2, so we need to try to people pregnant, so really have to calm. Pregnancy is really like a very beautiful thing, actually. When you're pregnant, so your physical have lots of discomfort, but your mind, your heart happy, but sometimes they can have like how they say, depression. So because your body imbalances, so we really need to calm down your emotions. Sometimes if you overworked, sometimes emotion stage, you have like we're talking 7 emotion in Chinese medicine: joy, and sad, and grief, and anxious, fear, anger. What kind of all emotions? So we need not overly produce. So we need to keep the calm, keep qi calm. And I think just like they did also research, calm person, if you really calm, everything you speak slowly, walking slowly, and thinking, not overworking, those kind of people. And after the baby born, they very easy to raise. So they don't have like fussy, they don't have easy to feeding the baby. And also the baby emotion, not like angry easily, not cry easily, just peaceful. Again, so from first trimester, it's almost you welcome your soul, the new soul to your body, whatever your state of mind, really affecting your baby's mind, affecting baby personality, affecting your baby be kind. So that's why first of all, I always say in Chinese medicine, very, very important is to try mindful and to clear your thoughts, and also tranquility your mind. So that's all be really helpful. So, and next one is the time fetal training. So almost like I are talking avoid the extreme emotions. So like so and in the blood can have healthy baby help. Next one is the timely like fetal training. Time fetal training, we're talking 1 or 2, 1 and then number 2. Number 1 is the auditory training. So in second trimester of pregnancy and the middle year, the baby will be development. So that's why, so as long as like 13 weeks older, you should starting to recite the poem, beautiful poems, sing a song, and talking to baby, and try to play the audio cassette or beautiful music by iPhone or something. So, and then try to really to starting to train your baby to understand you, almost like invite the baby, the soul into new world. So beautiful things. So this why the baby will be more concentrating when after birth. They did research also says the baby will be more concentrating, more in the later on they have learning of is super smart, really strong. And in additional, and if you constantly like talking, try laughing more, and the bird sing, and also the ocean sound is also good choice. And also modality like music and instead rock music, so really helpful. And also please do not see violent movies, violent things, and also don't speak dirty words. And when you speak, the baby can hear. So, and like I said, we're talking about the water, and it's know everything. So, and the amnio fluid, so your thoughts transforming from the amnio fluid affect your baby. So you thinking positive thoughts, you speak kind words, your baby knows, and your baby happy. So your baby just even cultivating your baby beautiful future and a good body and a kind person, and to training the nerve system to be able to set up straight. And then next is the touching training. So pregnancy also, when you lie on the side, lie on your back at night. So, and from the second trimester and also first trimester, you can just gently press on your abdomen to starting talking to the baby. Being touching is just they almost like your both hands is the heart channel. So by touching and your baby more close, your baby will be less fear when they're born. So you more feel strong and emotionally, physically as well too. And the modern medicine believe that this affect the complete thoroughly in the fetal nervous system. So, and this kind of the people, just baby, and ending up more strong and the more happier. They don't feel fearful, you know. Touching is very, touching you can just template, like simply put your finger on to touch your baby. You can do clockwise, you can do unclockwise equally. So when you tapping, it's not supposed to so hard, just gently tapping. That's really good. Okay. And the next one, and we say modern medicine believe that the touching is affecting through the fetus nerve system and the developing. We don't need to read the thing, just like seeing. If you're touching, you can feel people is more, the baby will have a more movement. But again, so one thing you have to avoid it, if you have early contraction, you're not supposed to touching your body so much. So you don't need to encourage that. But if you want to normal delivery, so touching the baby, touching your stomach is a really good thing to do. And you can have on-time delivery as well too. And the next one. So, and it's time just like a research we show. So next one. I will have a conclusion. Next one, we want to talking about the good quality sleep. So, and the early pregnancy, and we really require people lots of sleep, almost like 14 hours and then 10, 12 hours. Naturally, and the woman just feel tired, and naturally just feel tired. And now, so, and when in the first trimester, we ask people more sleep more. And the last trimester, we also help ask people sleeping more. So, and the woman should be take a nap, should be doing too much housework, and do not lifting 5 pounds weight. So, and you can exercise, but please do not do strenuous exercise. You can gently walking, you can do simple like prenatal yoga. That's a good thing to help. And also for the position wise, you can lie on the side, not necessarily left side, just left side is better. And the side, the right side, left side sleeping for pregnancy baby. So after first trimester, that's really great. Please we do not recommend sleep on the stomach. That'll be hard to breathe and hard for your baby grow. The chi is not flow. So we really prefer people sleep on the side, have a body pillow, just like everybody come to our clinic, to position you. That's a really good way to sleep. And the good sleep can help you cultivating your chi in the baby's blood to help the woman to rejuvenating your gene. So really, so the sleeping and is crucial. And also when you're pregnant, please do not ask you working in the night. That's nightmare, you know? So, and very easy, the research, and very easy to miscarriage as well too. So just sleeping good and sleeping earlier, that's better. Okay, number 4, next one. And the nutrition diet. I guess Dr. Lim, so I'll be really took this over to think, but for now, so I'll be continue for my part, and Dr. Lim, I'll be continue. I just quickly go through nutrition diet during pregnancy, and really this variety is the key. So, and the early pregnancy diet should be light and very fine. What mean light? Lighter. Lighter is which means we're not supposed to eat so much meat, especially heavy meat. So during the pregnancy, early stage, and you have morning sickness, you really do not want to eat so much. Only you wanted to just go home to sleep. So I totally understand, but it's what pregnancy. But because this thing, we need the nutrients. We need like a soup, the green color vegetables, and the more alkaline food. We do not need to make you swollen, you know. So alkaline food like a tofu, like a kiwi, and also like the Chinese yams, and also like a mung bean and the rice. So, and the barley is really helpful. So in pregnancy lady, because the baby is considered as young energy, so the rice is considered as the cooling energy. So eat more rice, is white rice, more helpful to helping balance the qi. So which means in traditional Chinese medicine, we really encourage people eat more rice, brown rice, white rice, to harmonize the body with the baby. So I'll be to help you not to constipation or diarrhea. So which is the eat light. Number 1, the rice is the main course, and also second is like the protein. We need the fish, shrimp, and also a little bit of like eggs. And if you see someone like the cheese, you can do cheese, but not excessively, you know, just like moderation is the key, and choose the variety of food. And also we really need to encourage you to eat very sour appetizer, so which means like hua mei, so, and also like a grapefruit, so really helpful. And also the sour food, why? Because it's in the beginning, first month is liver channel to nourishing the fetus. Liver channels like the sour things, and the liver channel also is your baby liver channel starting set up. So which means they encourage you a little bit of sour taste to helping to digestion better. And then we really have to avoid pungent food and spicy food, those kind of things. The high alcohol definitely is not allowed, and those kind of things. And the second trimester pregnancy, and we should be just starting to baby pregnancy women start to feel comfortable. We need to encourage people go outside with the shiny, so like outdoor work, and then you can eat a variety of food, which is like if you like lambs, beef, should be organic, and also to avoid the anemia. So, and this time you can just try eating more. So meat and also rice is still, and the green color vegetables are more alkaline. So in this moment, so just like you cannot eat too full. You cannot eat you cannot not enough. Just like we encourage people, small portion more frequently, and also just like 80% full. Because otherwise the baby grow too fast, and your body going so much weight. It's not healthy, it's not comfortable as well too. And then next one, so 8 months time. So during the 8 months, and almost like your baby and the brain and the bone and the skin and also 5 organs have everything starting to set up. So in this moment, you really need still eat a variety of food, and also you need just like not too full, start to decrease your eating. So I want to try to take a nap and walking slowly, and then less you need to eat less salty food, and encourage you to eat alkaline food, and preventing the edema. So when the 8 months old, it's like the baby all pressed on there, so very cause you swollen. So, and salty food should be avoided, and also the alkaline food should be encouraged. Alkaline food, first of all, can help you fiber, to help you not constipation. Second, it can help you edema. That's really the things. And avoid it. So, and pregnancy lady, in the general guidance, we should avoid just like something make you allergic. So number one. Number two, you cannot eat spicy. And the spicy, they say, is if you constantly eat spicy food, first of all, very easy cause you have lots of fire. So, which means easier for you catch cold, either just your body imbalance, and also to make the baby personality-wise just very easy, angry easily, and cry easily, just like not even. We need a neutral food. So when you neutral food, your body comfortable and your baby will be comfortable. So by now, so when you're pregnant, you're thinking your baby, your thoughts affecting everything your baby very closely. So they have close relationship with the mother. Okay, that's why we try to use, you cannot use the hot pepper and the other stimulating food and allergic to food. And next. Okay, so number 5, I would just say the living with the caution. So when you just the pregnancy and you qi and the blood down to the uterus to try to cultivating a fetus. So in a way, so your immunity is low. In this period of time, any kind of wind, any kind of like the waves, very easy to let your pregnancy catch a cold. So sometimes they catch a cold presenting just dizzy, just like a sore throat. So those kind of things we call evil qi. So Chinese medicine have a great idea. So if you come to our office, we know you're sick, just 2 or 3 bags tea, you'll feel better right away. You don't need to bother to take anything else. Again, so we're not supposed to let you take anything else for the cold. So which means, but in this moment, first trimester and last trimester, very easy catch cold. So in order to make your body healthy, we just need to regularly come to acupuncture, check with us. And then in the first trimester, we ask people coming once a week. And after, from second trimester, you just come once a month because you're really on the regular way. In the last trimester, we ask patient coming once a week, again, to encourage you to prepare you to delivery. So just set up delivery process easier. That's beginning with the last trimester. And living with caution. Number 6, we want to talk a little bit proper working and rest. And please avoid the sex during the first and trimester pregnancy. So in the first pregnancy, first time, like I said, we really require your environment by your alone. You create like a quiet mind and the physical body and the environment, the quiet. Do not have too much noise, including womb, so you cannot have sex. So early pregnancy have sex is really easy cause you miscarriage. Can encourage your patient have a bleeding. Okay, that's number 1. And the number 2, last part of the pregnancy, very easy to cause the last trimester you have too much sex, and really easy cause you sometimes a premature delivery, and sometimes cause you uterine the infection, and the severe can cause like the baby's death. So sometimes can happen that one. So which means in first trimester, last trimester, we educating women do not have too much sex. That's important. And also, which is like briefly to talking, and with Chinese medicine, we go month by month to raise the baby. So which means the first month, like I said, so like the first month really is the liver, nourishing the by liver channel, and therefore we cannot needle your liver channel. And the pregnancy woman should be rest and cultivating yin and yang qi, and the food should be very light, and encourage to eat like a salty food, like a sour food, to helping compromise a little bit. Second month is like a gallbladder channel setup. Gallbladder channel is also yang channel, so paired with liver. Then in this moment, it's a yang qi rising time. So the baby fetal qi, yang qi starting to development, and all the joints is starting forming. So, and therefore we cannot needle your gallbladder channel, but we can needle your mother channel, which is a kidney channel. So, and also this time is due to the growth of fetus. The fetus really grow two channels supposed to set up. Therefore, so in the diet, we're not supposed to let you to eat, avoid pungent, hot, drying food, which is the fried food. And it should be greasy food, have like a meat, or we don't like it. We prefer you eat more soybean, sesame seeds, walnuts, shrimp, and the fish. Prefer about eat a bit of sour and food, and you have to eat more well-cooked food, not just like raw food. And the third month pregnancy, and you just really supported by heart channel. Heart channels really to helping you set up the blood vessel. The blood vessel set up, you have blood circulation flow. So, and we really suggest you eat more barley in this moment to support your brain, and also eat more like walnuts, nuts, and pecan, those kind of things. Fourth month is nourished by 三焦 channel. We have triple jiao. Triple jiao can nourishing the 五脏, which is to set up you like almost like a link for whole entire body to nourishing. And the diet wise, we just needed to principle should be just avoid the greasy food and eat more soup. So chicken soup and fish soup. So it's the best choice. And also we can just help you should be mindful to avoid catch cold. So the first month don't catch cold. Fifth month is to cultivating baby's qi, fetal qi. So, and usually we should eat more, sleepy longer. We just ask the mother try to sleeping longer time, and change the clothes often, keep yourself warm, and take a bath and expose the sun side. Encourage you people go outside, doing more exercise. And the fifth month, and just again avoid the dry and the spicy food. 6 months is like a 6 months is like a stomach channel. So to stomach channel in this moment, so to fetus newest joints starting to form up. So we really help if you're cultivating your stomach qi, and your baby's joints will be strong, have a long, beautiful body. So it's great. It should be eat a variety of food. And 7 months is the bone. So what do we say? This is 7 months is lung channel. So, and the lung channel is like the spleen is the mother, and spleen is this support the bone to form up. So just quickly for then you sign in this moment. So just like you can start at 7 months, and 6 months you can start to have herbal tea to balance with it. So we try to eat more alkaline food, just to try to like white rice and lily, and the Chinese yams, and the white fungus, and lotus root, and also pear. So the pear is the lung channel to help the bone. And the 8 months, the large intestine. Large intestine, supposedly, like I said, do not try to make you constipation. So alkaline food is recommended. So I already said lots of times the fiber. So like a pumpkin, corn, oats, and the celeries, grapefruit, and also tofu, seaweed, you can have it. And 9th month is the kidney channels, and the nourishing the body, and then you almost like form up your skin. The baby's skin finally 5 down, 6 full, all almost form up. So you become a new baby. So, and in this moment, there should be just try to eat more sesame seeds, help the black bean, and then also liver, mushrooms, sea cucumber, so, and black juju berry, just like almost goji berry, to nourishing the kidney qi. and the 10th month is the UB bladder channel. So therefore, when we have like a breech baby, we use the channel to treat your UB bladder channel, the breech baby can fix. And also, if you have past due, so when you needle your UB bladder channel, and then you will be delivery faster. So we can do lots of things to helping the woman in Chinese medicine, help you healthy woman, healthy baby, and ending up your family happy and healthy. I think I just briefly to say and roughly, because time is limited, and also all the information will be put on the blog and on YouTube as well too. So now, Dr. Lin, I'll be introducing more detail for diet. Welcome.
Okay, so I'm just going to change screens here.
Yeah, I'm done.
Okay, can you hear me okay?
Yeah,
okay.
I can hear you.
Okay, so we're going to talk about kind of a little bit more in detail foods that can be beneficial for pregnancy. And let me just here. Okay, so so during pregnancy, you know, the diet is really important, and so you know, when you're getting beneficial nutrients into your body and eating properly, it can really help to alleviate some of the symptoms that can happen during pregnancy. So, for example, you know, morning sickness, helping with your energy levels, helping to optimize your child's, you know, their fetal development with their skeletal system, their brain development, helping reduce the chance of eczema, asthma once they're born, helping support a healthy immune system, and helping to also prevent or minimize postpartum depression. So we'll talk more in detail about these. So these are just kind of general rules for pregnancy, the do's of eating. Like Dr. Jing had mentioned, eating more whole grains, brown rice, lots of organic fruits and vegetables, having good quality protein in your diet, and also healthy fats. So things like fish is one of those things because it contains the omega-3 fatty acids can be very beneficial for pregnancy. And as we'll see as I explain more, the omega-3 fatty acids it's one of those essential fatty acids that your body cannot manufacture on its own. So you really have to get it through food sources. And so the don'ts of eating, so you really try to avoid trans fats, saturated fats, those things you usually find in like packaged goods, chips, potato chips, you know, fast food, those usually contain a lot of trans fats, which are more inflammatory for the body. And you want to avoid caffeine, refined sugars, alcohol, sweets and candy, improperly cooked food. So when I say improperly, it's more just making sure that your food is fully cooked. You want to try to avoid, you really want to avoid raw foods or like things that are not cooked well, because there is greater risk for bacterial infection during a pregnancy, and also high risk foods. So in terms of high risk foods, this is just kind of a general list of foods that may have a teratogenic effect on the fetus. So some of these things like alcohol can cause, for example, fetal alcohol syndrome. And caffeine also has been known to have a negative impact and can actually increase the risk of miscarriage and also interfere with the growth of the fetus if you have more than like a cup and a half per day if you drink it very regularly. And one of the reasons for this is because the caffeine can actually cross through through the placental barrier, and babies don't actually have the enzyme. Babies in the placenta don't have the enzyme to break down and metabolize caffeine, so it tends to accumulate. So it's better not to avoid caffeine while you're pregnant. And then So these are just some of the things that can negatively affect the fetal development. So we talked about caffeine. So drinking more than 200 milligrams of caffeine daily, so that's about a cup and a half of coffee or 25 ounces of tea, can double the risk of miscarriage, according to some research, and can lead to restricted fetal growth and low birth weight. Besides coffee, black tea, green tea, and also even chocolate and soft drinks can contain caffeine. So you just want to be careful about that part. And so these are just some of the key nutrients that are really important during pregnancy. Of course, we all know that folic acid is really important during pregnancy, and it's involved in the growth and division of cells. If you have a deficiency, it's linked to neural tube defects. And so most of us, if you're taking prenatal vitamins, you most likely don't have to worry about this so much because most prenatal vitamins do contain the folic acid. There are things that can help in the diet that have higher levels of folate, and so I just kind of listed them here. Again, if you don't have time to write it all down, you can always, we're going to post it on YouTube, so you can always either screenshot it or take a look at it later. Most fruits and a lot of vegetables, dark green leafy veggies, legumes, nuts and seeds also have folic acid or folate. Iron is also really important. So when you're pregnant, your blood volume can actually almost double. So it's really important for women to get enough iron in their diet during pregnancy and even postpartum. A lot of women can become anemic during pregnancy, and also if you're not getting enough iron in your diet, it can increase the risk of postpartum depression as well. So you want to really make sure that you're getting iron-rich foods into your diet on a daily basis. And so besides dark meat like red meat and lamb, there's a lot of vegetarian sources of iron as well that you can get from the diet. So especially the dark leafy green vegetables, beets, wheat germ, legumes, egg yolk, blackstrap molasses, seafood. Tofu also has iron as well as calcium. A lot of the fortified cereals and grains have iron. So there's a lot of options out there for you. Just make sure that you're getting in, regular dose, a lot of it during pregnancy. And another thing is that vitamin C can enhance the absorption of iron. So if you're eating, let's say, dark leafy green vegetables like spinach, you can also have an orange afterwards to increase the absorption of iron. And also cooking with a cast iron pan can also help help with getting the amount of iron, increase your iron intake. Calcium and vitamin D. So this is also really important to get during pregnancy, and a lot of women don't get enough calcium during pregnancy. Your prenatal will also have some, but it's also important to get it through diet. It's important for healthy bones and also the fetal bone and skeletal development. It can also help with decrease your risk of preeclampsia, which is high blood pressure during pregnancy. It can help, together with magnesium. Calcium can help with decreasing leg cramps. A lot of women during the 2nd and 3rd trimesters, they start to experience a lot of leg cramps at nighttime or muscle spasms in their legs. And so a lot of times magnesium, like some of my patients will take the natural calm powder during pregnancy, which can help with the leg cramps and also constipation, which a lot of women experience. When you do have calcium-rich food, though, you want to avoid eating iron-rich food at the same time, usually, because they can calcium inhibits the absorption of iron. And usually you want to be getting 1,000 milligrams per day of calcium. So typically, like, for example, 1 cup of yogurt has about 400 to 500 milligrams of calcium. So, typically, like some of the dairy products, yogurt, milk, cheese, you want to be getting more of that during your pregnancy. But there's also vegetarian sources and vegetable sources of calcium as well. So tofu, a lot of the dark green leafy veggies like collard greens, broccoli, those also have calcium. And fish also, if you get the canned salmon or sardines, because the bones are inside there, so that also is a rich source of vitamin D as well as calcium. And sesame seeds also actually have a lot of calcium as well, and dried figs as well. Okay, so vitamin B6. And vitamin B6 is important to keep a lot of the B vitamins in general, so B12, B6, they're all really important for helping with energy levels, helping with also absorption of helping to metabolize the fats, carbs, and proteins in your body into energy for your cells. And so B6 is also helpful during the first trimester. A lot of women have nausea and morning sickness during the first trimester. So some doctors will prescribe diclegis, which is a prescribed prescription medication for morning sickness. But basically diclegis is the same thing as taking vitamin B6 with Unisom. So if you are experiencing nausea during the first trimester, you can try taking 25 milligrams of vitamin B6, sometimes up to 3 times a day. And some patients will take it together with Unisom. Okay, DHA. So like we talked about earlier, DHA is a really important essential fatty acid, and it's really important for the baby's brain development during pregnancy. And they found, a lot of research has shown that when you're getting essential fatty acids, enough of it during pregnancy can actually help decrease the risk of developing postpartum depression. It can help to reduce the risk for preterm delivery and low birth weight. It can help reduce the risk of children getting asthma and eczema once they're born. And they found that women who eat 2 to 4 servings of the fatty fish during pregnancy, like mackerel, sardines, anchovies, herring, wild salmon, they found that the children who were born from those women actually had higher IQs, better sleep, better vision, and also better language and communication skills. If you do purchase fish, it's preferable to buy wild fish as opposed to farm-raised fish. And you want a fish oil supplement that contains at least 300 milligrams DHA per day. Now, one thing about getting your omega-3s is that a lot of, sometimes vegetarians don't want to eat fish, and they try to get it more through plant sources like flaxseed or chia seeds, hemp seeds. And that's good as well, because the alpha-linoleic acid can convert to the EPA and DHA, but only thing is that it's not a very efficient process. And also it's the fetal liver is not mature enough to metabolize the plant-based ALA into EPA DHA. So if you're able to have more like seafood and fish-based DHA from your diet, that's actually, your body's going to be able to, and the baby will be able to absorb it much better. So during the first trimester, as you can see, there's a lot of cell division going on, and the baby's heart is already forming, the cardiovascular system is already forming, and all of this takes a lot of energy, right? So the woman's blood volume increases, her heart rate increases, your increased hormone production, mood swings, morning sickness, all these things can happen during the first trimester. So you want to make sure that you're getting enough calories during pregnancy, and also protein, all the nutrients, so that your body can have the energy to support all these changes that are going on during the first trimester. One little tip for morning sickness is, for some people, it can help to smell a lemon peel or an orange peel if you're feeling nauseous. That's one trick. And also, like Dr. Jing said, the first trimester especially is the sour foods are really helpful. Some women find that drinking lemonade, sour candies, sour foods can help with the morning sickness and nausea. Of course, different women have different cravings during the pregnancy. Some women really start to crave beef and red meat, so they want to have hamburgers, and some women can't handle meat. Some women just want to have more juice and lighter, easy to digest things. Some women really crave carbs and cheese, and so it kind of varies from person to person. So you want to, obviously you want to listen to your body and eat what it feels like, but at the same time you want to be careful you're not eating a whole bunch of junk food either. So there's always, and we'll kind of look into this, but there's, you know, you want to try to find healthy options to satisfy your cravings. So protein, vitamin A, vitamin E, folate, iron, these are all really important during the first trimester. And vitamin A and vitamin E, and just and vitamin C as well, the antioxidants, these are really important to prevent DNA damage to the cells as they're dividing. So it's really important to make sure that you're getting enough antioxidants in your diet. Vitamin C also is really good for the skin. And as you know, women, when they're pregnant, their skin their belly stretches, you know, the skin changes. And so vitamin C is really helpful because it helps with collagen, you know, helping build collagen in the skin. And so it helps retain the elasticity in your skin. Same thing with, so I would say vitamin C and silica are both good for the skin. Silica is found in foods like celery, asparagus, rhubarb. Those 3 foods contain a lot of silica. So you want to make sure that you're getting a good amount of silica and vitamin C for the skin during your pregnancy. So top foods for the first trimester. So these are just some recommended foods. The reason why I listed these is they tend to be a little bit easier to digest. So, you know, applesauce, lemons, kiwis, those are a little bit easier to digest. And let me just make sure. Okay, so let's see. Sweet potatoes also, they're very rich in vitamin A, which is beta carotene. Whenever you have foods that are high in beta carotene, like those orangey colored foods, you want to always, like things like carrots, sweet potatoes, you always want to mix it with some sort of fat or oil because it's a fat soluble nutrient. And ginger can help with morning sickness. So you can make like ginger tea during the first trimester. Also mint tea, vegetable broth or bone broth, those things are kind of easier for your body to digest. And with bone broth, you're getting a lot of nutrients and minerals, you know, through the broth, but you don't have to but it's on the lighter side, so you don't have to eat too much like heavy meats or things like that. Some women crave salty foods during pregnancy, so that's why for some women, they like to have more salty foods. So if you're trying to get omega-3s in your diet, anchovies can sometimes be, some women like to eat them, and there's ways of eating it that can make it taste good. Let's see, what else? Also, with morning sickness, sometimes having like a protein at nighttime can be helpful. So that's why like having peanut butter at nighttime before you go to bed, or some sort of small amount of protein, can be helpful for keeping your blood sugar level more stable during the nighttime, so you're less likely to wake up feeling nauseous. And let's see what else. And also, if you're having aversions to meat during the first trimester, you still want to make sure you're getting enough protein. So that's why things like legumes, beans, lentils, the nuts, nut butters, almond butter, sesame, tahini, those are really good ways of making sure that you're getting enough protein in your diet during the first trimester. So during the second and third trimesters, your baby's really, you know, all the organs are forming, your lungs, kidney, heart are forming, and the baby starts to accumulate more fat underneath the skin. So it's really important for you to make sure you're getting healthy oils and fats into your diet, things like avocado, you know, the omega-3, continuing to eat, try to have 2 servings of some sort of omega-3 fish per week, nuts and seeds, so all those healthy oils. And oftentimes women during this time period, they start to have more like heartburn because the baby's getting bigger and it's starting to press up on the stomach. So more heartburn, constipation, leg cramps, feeling tired, backaches, nosebleeds because of the increased blood volume, and bleeding gums, dizziness. So during the second and third trimesters, you want to try to really have smaller, more frequent meals. Avoid more like the spicy, overly greasy, or high, you know, fatty foods that are hard to digest. and continue to have more high fiber foods and drink enough water regularly to avoid the constipation and also help with prevent UTI. During pregnancy, it is much easier to get urinary tract infections because, you know, first of all, the uterus, the baby is pressing on the bladder, so you feel like you have to go more frequently, but there's not as much coming out each time, so it's easier for the bacteria to accumulate in the bladder. So you want to make sure that you're drinking enough water, going to the bathroom regularly. And so third trimester, similar, just make sure you continue eating smaller frequent meals. A lot of times the feet and the ankles can get more swollen, especially in the third trimester. So you actually want to make sure you stay hydrated to help with the fluid balance in the body. Decrease your sodium intake and try to eat potassium-rich foods, which can help. And so preeclampsia also can occur, you know, during pregnancy, especially during the, you know, third trimester, or sometimes for some women after they give birth in the postpartum period. That's why, like, postpartum care and, you know, trying to take care of yourself after you give birth is really important, not just during the pregnancy, but, you know, continuing to monitor your blood pressure after you give birth. And there are certain foods that can help to decrease your chance of getting preeclampsia. So really making sure that you're getting enough calcium during the pregnancy. That's why try to aim for 1,000 milligrams per day of calcium-rich foods. You know, taking selenium, research has shown that women who's had sufficient selenium in their diet also had decreased risk of preeclampsia. There's a lot of selenium-rich foods, such as Brazil nuts are actually one of the highest sources of selenium, Brazil nuts, and also a lot of seafood, fish, shellfish, those also have selenium as well. Okay, so key nutrients during the second and third trimesters. These are just some of the standard recommended intake of a lot of the key nutrients during pregnancy. So we're not going to go into too much detail with that. Top foods for the second and third trimester. So you want to get the biggest bang for your buck, right? So you want to really eat high quality foods. And so basically these are just kind of a list of foods that I've gathered that have a lot of different nutrients for each type of food. So with so for example, you know, cherries, kiwi, those are all high in vitamin C. Papaya contains the papain, which is a digestive enzyme, so it can help a lot with digestion and heartburn when you're pregnant. It's really helpful for digestion. You just want to make sure that you have the right papaya, not the unripe papaya. The unripe papaya, actually, if you eat too much of it, has been linked to uterine contraction, so you don't want that during your pregnancy. Cranberries can actually prevent bacteria from binding to the bladder lining, so it can be helpful for preventing UTIs during pregnancy. Vegetables and herbs, so things like basil, carrots, dark leafy greens like kale, spinach, these are all really good during pregnancy. Celery, like we talked about, is very hydrating, but it also contains silica, which is important for the skin. And it also contains potassium and sodium, which are electrolytes basically, so they're important for fluid balance in the body. And mushrooms also in general, mushrooms contain a lot of folate as well as selenium. So we talked about how selenium can be helpful for preventing preeclampsia. And selenium is also important for thyroid function as well. And spices, okay, so spices. So these are just some spices. Garlic in particular, chamomile tea can be helpful for women who have insomnia during pregnancy. It's kind of a calming herb. And so just 1 cup per day, you want to limit it to 1 cup per day. And it's a good alternative to caffeine as well. With garlic, they found that it can actually help with preventing strep B infection. So sometimes towards the end of pregnancy, usually doctors will test for the strep B around 36 weeks of pregnancy. But having garlic regularly can help with reducing the risk for strep B. And of course, there's herbal teas, the Chinese herbal teas that can help a lot. If you have a strep B infection, there are herbal teas that can help that as well. Nuts and seeds, like we said, it contains a lot of the healthy fats. And sesame seeds in particular are really good, high in calcium and iron. So if you're vegetarian, sesame seeds are a good source of nutrients. Brazil nuts are high in selenium. Chia seeds and hemp seeds, those can also help with constipation just because they have a lot of fiber. And pumpkin seeds are high in magnesium and zinc as well. We talked about fish. We talked about just getting enough dairy, calcium in your diet. Probiotics like kefir, yogurt. Probiotics are really beneficial for not just for the mom's digestive system, but also for immune system function as well. And they found that moms who took probiotics regularly or had probiotic foods during the pregnancy can help also reduce the risk of eczema in the kids after they're born. And chickpea, tofu, black beans, and those are all different legumes that are recommended as well. Black beans are great because besides having a lot of fiber and also the iron and nutrients and folate, because they're black color, similar to that you find like in grapes, berries, and cranberries, they're high in these compounds called anthocyanins, which are these antioxidant compounds that are really beneficial for your overall health. Yeah. Black beans also contain tryptophan, which can help with sleep. And I think that's it, hopefully. With the sweeteners, the blackstrap molasses, the reason why I kind of mentioned it there is it's because blackstrap molasses is a sweetener that has a lot of nutritional value as well. It has a lot of minerals, iron, and some of the trace minerals that can be helpful during pregnancy. And so make sure I don't forget anything about that. And last thing is the coconut oil. They found that coconut oil contains a saturated fat called lauric acid, which has a natural antimicrobial function. And they found that this particular fat is actually found in high amounts in women's breast milk. So in general, the coconut, because it has antimicrobial action, it can also help with preventing bacterial or viral infections. I think that's it. Okay. And then I think we are finished. Okay, so I'm going to try to unmute everyone here.
Hi, thank you for the presentation. I was just wondering about barley tea. You know anything specifically, like if it's okay to drink mugicha?
I believe it. I mean, I think it's fine. The barley tea. Do you have any?
Barley tea is
actually
good.
Good for
Barley tea is good. Yeah, it's good. You can drink it.
Okay, not too much sugar or anything.
Oh,
if it's too sugary. Yeah.
I would try to get unsweetened barley tea.
Exactly. Mm-hmm.
Yeah, they sell it at Korean or Japanese supermarkets usually, just the barley,
yeah,
dried barley. And if anyone has any questions, feel free to ask. Hopefully everything was clear and you guys could understand what we were saying.
I've heard that the ginger might not be good during pregnancy at certain times. Is that true, or is it safe?
Ginger tea.
Yeah,
I think it's safe, especially your constitution. This is the qi deficiency. So which means the doctor says, oh, you're splitting qi low, so you don't have problem. So just like when the last trimester, you have to avoid a little bit. Early on, you should find. Yeah. Mm-hmm.
And we want to thank everyone for joining us today also and staying here with us through the session.
Thank you.
Okay, thank
Oh,
you,
I had one more
everyone.
question.
Uh-huh.
Oh, sorry. Just one more question. Could you talk a little bit more about like gestational diabetes and why it occurs from a more, Chinese medicine perspective? Like, is it the placenta overproducing, basically doing its job too well and creating insulin resistance, or is it the woman's body not producing enough insulin?
I think gestation diabetes usually happen on so like you have before your pregnancy, you have like an insulin resistant condition. So back then, so your body just insulin functions not properly. So and when you're pregnant and just if you diet not cautiously, especially eat lots of carbs, eat lots of like a sugar. So even your same amount as other people, so you can increase your insulin functions even worse. So they definitely PCOS patient can have it, and the how they say insulin resistance patient can have it. So and also diet can increase that. If you really you're pregnant, so you eat lots of cake, you eat lots of carbs, lots of things, and supposed to be lots of wheat, so you really increase the risk. It's your body insulin function not properly to cause your blood sugar high. When your blood sugar high, so affecting your baby will be grow or overgrow. It's not healthy for the baby, the brain, everything. So I hope you answer your question. Just your body before you're pregnant, you have a foundation to turn that way. So really, if you have, how do you say, we have special diet. If you in our clinic, we have a 20 gram and a diet special for gestation diabetes. So and then you only can have 20 gram and like the carbs. So rest we have simple meal, so typed out. So if you really have this issue, you can really got it. But again, in Chinese medicine, we think your body yin deficiency, your qi, mostly your yin deficiency is drier. So your dryness. So you need to drink enough water. You need to nourishing the yin, and to your yin strong and your qi will be balanced. You don't have fire. So you do not have so much like the gestation diabetes.
So kind of like 上火, like too much.
上火, yeah. 上火, 阴虚火燥.
Although I've known some patients who are a little bit overweight before they're pregnant, sometimes during their pregnancy they have no sugar, gestational diabetes, and then I've known other patients who are very skinny, skinny types, and then during pregnancy they had gestational diabetes. So it seems to kind of not make sense always who gets it and who doesn't. But I think
that's what I'm curious about.
Yeah. But either way, it's beneficial to really, try not to have too much sugary, refined foods when you're pregnant anyways. Okay. If no one has questions, don't be shy.
Yeah.
Okay. So
hopefully we can give everyone a little bit tips during the pregnancy, so that can help you take advantage for Chinese medicine and acupuncturists, and just regularly checking with it. So to have your healthy pregnancy and healthy baby, and later on your baby will be more, so like a healthy, smart, happy, easy to raise, and be a parent. So it's a mostly happy thing to have. We really help everyone to get some tips. That's our today's purpose to do. And later on, so next one, so we prepare to have the talk for postpartum care. So we call 100-day care. So we have to, if everyone interested, and just wait next month, we will have the talk again. So hopefully everyone enjoy.
Okay, thank you.
Thank you.
Bye.
Bye.
Bye. Thank you.
Mm-hmm.